A $9 billion empire celebrated by the world's financial elite rested entirely on a physical impossibility. Patients walked into commercial pharmacies, offered a single drop of blood from a finger prick, and trusted a black box with their lives, their pregnancies, and their cancer diagnoses. Yet behind the sleek laboratory doors, the highly touted revolutionary technology was secretly dumping those tiny blood samples into conventional, secretly modified machines, yielding wildly inaccurate results. This was not merely a case of aggressive startup marketing, but a systemic, highly calculated subversion of medical science and financial trust that endangered thousands. The anatomy of this deception began in the fertile, venture-backed soil of Silicon Valley, an ecosystem hardwired to reward audacious disruption and visionary promises. Elizabeth Holmes, a 19-year-old Stanford University dropout, recognized that investors were desperate for the next generational genius. She adopted the uniform, the baritone voice, and the unyielding certainty of a tech messiah, promising to completely democratize healthcare. The narrative she spun was intoxicating, a world where painful venous blood draws were replaced by a painless prick, capable of running hundreds of diagnostic tests simultaneously from a single microsample. Central to this promise was a proprietary device named the Edison machine. The concept was elegant on paper, but it violently collided with the fundamental laws of fluid dynamics and biochemistry. A capillary blood sample taken from a fingertip is inherently contaminated with interstitial fluid and cellular debris, making it fundamentally different from a clean venous draw. Furthermore, attempting to run dozens of complex assays on a microscopic droplet requires diluting the blood to a point where the target biomarkers become mathematically undetectable. The physics simply did not work, and the chemistry was fundamentally flawed. When the Edison machine repeatedly failed to produce reliable data, the company did not pivot, reevaluate, or admit defeat. Instead, it built a clandestine shadow laboratory. Theranos quietly purchased commercial blood analyzers from established medical manufacturers, physically hacking the internal mechanisms of the machines to accommodate their highly diluted microsamples. This process, known as surrogate testing, where unapproved, altered third-party equipment is used to process proprietary medical tests, was strictly hidden from investors, federal regulators, and the very patients relying on the results for critical health decisions. To shield this covert operation from external scrutiny, Holmes constructed a corporate fortress guarded by one of the most formidable boards of directors in American corporate history. Rather than recruiting seasoned hematologists, clinical pathologists, or biotech venture capitalists, she assembled former secretaries of state, retired four-star military generals, and political heavyweights. This board provided an impenetrable halo of credibility. Their presence silenced skeptical investors. After all, challenging the technical viability of the company meant openly questioning the judgment of global statesmen and military leaders. Inside the Palo Alto headquarters, however, that halo fractured into a culture of profound paranoia and intimidation. Compartmentalization became the ultimate tool of executive control. Engineers working on the hardware mechanisms were strictly forbidden from communicating with the chemists developing the biological assays. Employees who raised concerns about failing quality control metrics or erratic data were swiftly marginalized, threatened with ruinous litigation, or abruptly fired. The corporate structure was meticulously designed not to foster scientific innovation, but to contain the devastating truth. This ironclad secrecy allowed the financial deception to scale at an unprecedented velocity. Between 2004 and 2015, Theranos raised over $700 million from private investors, family offices, and high-net-worth individuals. The fundraising strategy exploited a critical vulnerability in the venture capital ecosystem, the paralyzing fear of missing out on the next massive unicorn. By creating artificial scarcity, demanding absolute confidentiality, and leveraging a dual-class share structure that granted her absolute control, Holmes successfully bypassed the rigorous technical audits typically required for biomedical investments. Investors poured capital into a compelling narrative, actively choosing to ignore the conspicuous absence of peer-reviewed scientific publications. The theoretical fraud crossed a devastating threshold when Theranos rolled out its testing centers in retail pharmacies across Arizona and California. It was no longer just wealthy venture capitalists losing money on a bad bet. It was ordinary citizens receiving fabricated medical data that dictated their medical treatments. Patients received false positive results for HIV, erroneous indications of aggressively rising prostate cancer markers, and terrifying misdiagnoses regarding the viability of their pregnancies. The financial deceit had mutated into a direct, unmitigated threat to public health. The shadow of those modified commercial analyzers now loomed over tens of thousands of intimate medical decisions. Physicians, bewildered by lab results that entirely contradicted their clinical observations and the physical symptoms of their patients, began to quietly question the efficacy of the finger prick technology. Yet, the corporate machine relentlessly pushed forward, leveraging its massive $9 billion valuation to aggressively lobby state legislatures to allow direct-to-consumer blood testing without a doctor's order, further expanding the danger zone. The impenetrable fortress finally began to crack, not from external regulatory audits, but from the moral breaking point of its lowest-level employees. Whistleblowers, many fresh out of college, recognized the glaring, undeniable discrepancies between the public marketing claims and the raw laboratory data they processed daily. They witnessed the routine deletion of outlier results to artificially smooth quality control charts, a textbook case of data manipulation designed to pass superficial inspections. Despite facing aggressive surveillance, private investigators, and threats of crippling legal action from high-powered corporate attorneys, these young scientists chose to break their non-disclosure agreements. Their clandestine disclosures found a vital conduit in investigative journalism, specifically through the relentless probing of the financial press. As detailed in the subsequent published exposés, the facade was systematically and publicly dismantled. The investigative reports revealed to the world that the proprietary technology ran a mere fraction of the advertised tests, relying almost entirely on the secretly modified third-party machines. The publication shattered the reality distortion field that had protected the company and its charismatic founder for over a decade. The journalistic revelations triggered an avalanche of federal scrutiny, abruptly ending the era of unchecked autonomy. The Centers for Medicare and Medicaid Services descended upon the primary laboratory in California for a surprise inspection. Their findings were catastrophic. The agency issued a severe report stating the laboratory's practices posed immediate jeopardy to patient health and safety, citing massive infractions in basic quality control, personnel qualifications, and analytic reliability. The government effectively banned Holmes from owning or operating a medical laboratory for 2 years. Following the clinical regulators, the financial authorities moved in to dissect the economic wreckage. The Securities and Exchange Commission formally charged Holmes and her former operating officer with what they termed a massive fraud. As detailed in the 2018 SEC complaint, the executives had engaged in a years-long, multi-million-dollar scheme to deceive investors regarding the company's technological capabilities, its financial projections, and its alleged relationships with the Department of Defense. The complaint meticulously outlined how revenue projections of $100 million for 2014 were entirely fabricated, while the company actually generated barely $100,000 in legitimate revenue. The subsequent federal criminal trial exposed the granular mechanics of the deception to the permanent public record. Prosecutors presented a mountain of irrefutable evidence, forged validation reports featuring unauthorized pharmaceutical company logos, desperate internal emails detailing the scrambling to hide machine failures during VIP demonstrations, and the deliberate misleading of massive retail partners. The courtroom became a theater of forensic accounting and technical autopsy, proving beyond a reasonable doubt that the intent to defraud was not a momentary lapse in judgment, but a sustained, daily operational strategy executed from the very top. The collapse of this $9 billion illusion sent shockwaves far beyond the boundaries of Palo Alto, forcing a brutal reckoning within the global investment community. The scandal exposed the lethal danger of applying software industry paradigms to the life sciences. In traditional technology sectors, launching a flawed application and iterating based on user feedback is a standard, accepted business model. In the biomedical sphere, that same fake-it-till-you-make-it philosophy translates directly into medical malpractice, delayed treatments, and shattered lives. Today, the legacy of this spectacular failure serves as the definitive cautionary tale of modern corporate history. It fundamentally altered the landscape of venture capital due diligence. prompting a necessary pivot back toward rigorous, independent scientific validation before capital deployment. The era of the charismatic founder ruling unchecked by scientific peer review faced a harsh, uncompromising reality check, forcing investors to look past the black turtlenecks and demand raw, verifiable data. Ultimately, the story of Theranos is not merely about a broken blood testing machine or a fabricated financial spreadsheet. It is a profound study in the psychology of belief, the systemic vulnerabilities of unchecked ambition, and the devastating consequences that occur when the pursuit of visionary status eclipses fundamental truth. The deception was a masterclass in exploiting the human desire for a miracle, proving that even the most sophisticated financial ecosystems can be blinded by a compelling narrative right up until the moment the science demands its due.